right, so listen to this. For those of you that are right now having TMJ pain, this podcast will be super helpful. There are three, which Mac, of course, modified with his genius to four simple ways that are going to help your TMJ pain calm down. Listen up.
Okay, Pam, let's get right to it. What do you say?
I'm
I
ready.
hear
Let's go.
I hear people on Reddit and Facebook and everywhere else say, "What can I do at home?"
To help with
I
their
can't
TMJ
to help.
problems?
We're talking about TMJ problems. We're talking about TMJ pain. We're talking about discomfort. We're talking about not understanding what's going on with all the pain. And I can't find a dentist and it's too expensive. What can I do?
Okay, so let's talk about proper resting oral posture, okay, and how our listeners and viewers can do something super simple that can just help relax all of this as I'm pointing to my jaw and my face. So, good proper resting oral posture is defined by John Mew. He's the first person that came out with it. People all talk about the mewing as the kids point to their jaw lining, put their lips together and say, shh, so well done. Kids know about it. Too bad most clinicians don't. But what is good resting oral posture? It's three big things. Lips are together when we're not talking, of course. Tongue is resting on the roof of the mouth, and I'm talking the entire tongue. That big, strong U-shaped muscle covers the entire roof of the mouth. And breathe through your nose. So lips sealed, tongue on the palate, breathe through your nose. These three things can help with anybody who suffers from TMJ pain because when the tongue alone, which is the big muscle nobody ever talks about, but we're kind of obsessed with because we know what it means. But when that tongue is sitting up against the roof of the mouth, it makes all the chewing muscles, which your main elevating or closing muscles, the masseter, which is by your jawbone, your temporalis, which is by your forehead, it makes those muscles relax. It's very difficult for you to clench your teeth hard when your tongue is on the palate. Sensory wise, your brain will not let you clench hard when your tongue is on the palate like that. And it just helps you to breathe through your nose, which helps with anxiety and relaxes the whole system.
Yes, and you mentioned breathing. So if you can just visualize the intake of oxygen, and with the tongue closed, it's like a funnel, but it's going through your nose. And that is the way that it's supposed to be, that we breathe through our nose. So you also mentioned the fact that the tongue is U-shaped. And what should the palate be shaped like that? And the palate being the upper jaw and the roof of the mouth. How should it be shaped?
U-shaped, just like the shape of the
U-shaped.
tongue. Because as you said perfectly, like on one of our podcasts, you talk about like how the palate when the children are so young as infants, it's like clay. It molds to whatever we put in there. And ideally, it's supposed to be the strong shape of that U shape of the tongue, not a thumb, not a pacifier, but the shape of the tongue, because the tongue is supposed to be elevated to the roof of the mouth when the child or an infant is sleeping or has their lips sealed.
So let's reiterate what you said. Tongue on the roof of the mouth,
Mhm.
all the complete roof. Teeth not touching, which means teeth apart, and then lips together, which seals the mouth and forces one to breathe through the nose.
Correct.
Is that correct?
That is correct.
That is correct. So we need to also distinguish between a developing mouth and then your adult mouth, which the people have the pain. The developing mouth, the tongue does what? As you said,
Helps
it
form
acts
the mid face, the upper
like it.
jaw.
Yes. And so the palate should be shaped like a U, which the tongue is shaped like a U. So this only makes sense. And I'm asking the listener not to make all of this too difficult because it is simple. So lips together, teeth apart, tongue the roof of mouth, and chill, kind of relax, is easy to say, but it's hard to do because our mind goes somewhere else. As soon as our mind goes somewhere else, the teeth come down, the mouth, the lips are open, and the clenching begins or whatever it might be. So, Pam, I want to discuss how you and I are trained for our listener that while we believe that TMJ pain is has a lot to do with stress and emotion, It also has to do a lot with the mechanics of the mouth.
Right.
And so there are three different biting schemes, the way the teeth come together, that you and I believe in, called the trifecta. And there, what you have is a mechanical issue that's interpreted by the brain is a pain problem. So,
Pause you for a
I,
second, Fred.
yes,
I
please.
need to highlight what you just said there. TMJ, for our listeners, TMJ dysfunction, it starts as an airway and mechanical issue. And that means your anatomy started to develop wrong as an infant, into a toddler, into a child, into an adolescent. And by the time you're late child, early adolescent, there starts to become a psychological component that affects your focus, your cognitive development. And then as more into teenage adults, it becomes pain, depression, anxiety. It can happen earlier too with children, but that's the graduation of how things go. So there's a true anatomical airway issue, and then there's the psychosocial issue that also happens. I just wanted to emphasize what you said.
Yes. And I mean, in a few other podcasts I've mentioned, I know that you have, that you ask a patient that has all the signs of TMJ, but you ask them, do you have TMD? Do you have TMJ? No, I used to until I got a new job. I used to until I got a divorce. So,
Mm.
yes, there is a huge psychological component to this. So, along with lips together, teeth apart, tongue on the roof of the mouth, and to chill is also a big component of this. Look at your life as what's going on. Is there things that you could do to get rid of some of the stress? So stress has a huge part of this formula.
You know, when I treat adults in my office, like we have a long intake. Any of my listeners that are patients know, like there's a lot of information that we ask, but we want to spend that time and understand your history. It's very relevant. Everybody comes in with a unique set of issues. So we need to understand what's your history been. But when we do our initial conversation, we go through all the things that the patient checkmarked yes. And, we say, okay, if I can just take two of these issues away, just two, because there's usually a long list of them, what would they be? And so we write that down. And patients always know, they just spit it right out there.
Cool.
And then I'm like, okay, that's what we're going to focus on. And if I can get 70 to 80% resolution of these two symptoms, this is a success and we will continue. And usually, you do know when you're practicing, within the first week and month if you were on the right direction, if this is the right treatment modality, if your TMJ is due to TMJ dysfunction, like an oral issue, jaw issue. And then I tell them, I'm very clear on this because these people have had a lifetime of suffering. Okay, they're in chronic pain. And I'm like, I want you to be very clear. What our treatment here is not magic tonic or snake oil. Okay, it does not, give you the promotion at work. It does not save a marriage. It does not make you look 10 years younger. What it will do is get you these two things, if not more, get you out of chronic pain, will resolve those issues. So when life stressors happen, because they're always going to come, you're better equipped to deal with them because we've taken these pain factors off the table. So there are things like you're saying, like they have to deal with psychologically or family or, all the social issues that come along with chronic pain and just life. Um, but, so it's like a multidisciplinary approach. And our listeners, it's like some things that you just have to do for yourself at home.
I love how you get into things so deeply. It always excites me, and I always like watching you do that. But to get back to the simplicity of lips together, teeth apart, tongue on the roof of the mouth, and chill is really what we're talking about. Because let me tell you, listeners and viewers, Pam and I can sit and talk about this for hours and hours and hours. And the interesting thing is we're on the same page. I'm in a little rural town in Texas, and Pam is in the metropolitan Fairfax,
Yeah,
Burke
Northern
area of
Virginia, Fairfaxburg
Virginia.
area.
You're in where all the cosmopolitan stuff is, and I'm down in the country with my cows and stuff like that. But yet we know the same thing and believe the same thing and have the same experience in treating you pain patients. And we know that it can be too expensive, and we know that finding a dentist like Pam, and I'm now retired, it is almost impossible. So you have to really do, you have to vet these people. But let's get back to the topic of this podcast: is how can we help you at home? Okay, so is clenching a habit? No one really knows. But is shaking your leg when you're nervous a habit? Yes. Can you stop shaking of the leg when you're nervous? Some people can, some people can't. Can you pain softeners that we're talking to, can you tell yourself in a mantra, lips together, teeth apart, tongue on the roof of your mouth, and keep saying that and it be effective? Because as soon as you quit thinking about it, you're going to bite down and start clenching again. So some of the secrets to overcoming a habit is to put a timer, every 15 minutes. It goes off and it stops to remind you, hey, I need to chill. I need to keep my teeth apart. And why keep your teeth apart? Because when the teeth come together, that causes the mechanical trauma. So that's the reason you keep your teeth apart. While the tongue on the roof of your mouth, Pam explained, it relaxes all of the other muscles and keeps everything stable. Another little clue, if you put a rubber band on your wrist, and every time you find yourself clenching, stop and snap that rubber band. Pop. I mean, it
That'll cause
sounds
a
really,
different kind of pain.
so, yeah. So you divert the pain to something else. A lot of people have tattoos that said, well, it manifests a mental pain into a physical pain. So there's a lot of weird stuff going on, but they're all valid. And we just have to know our own bodies, and we have to accept who we are, and we have to kind of chill and just relax.
Well, there you have it. Something simple, hopefully helpful to all you listeners and viewers. What were the three things, Max? Say it again.
The three things: lips together, teeth apart, tongue on the roof of mouth, and the fourth is to chill,
Chill. That's right.
relax.
Although you elaborated on mine. Mine was nose breathing, but I like yours better because when your lips are together, you are breathing through the nose. So,
You
yeah.
create that funnel, and it's only got
And
one spigot.
always humbling me. All right, friend. Till next time.
Okay.